Sunshine, it's our sunshine.
I am Dr. Naveen Mehrotra, consultant neurosurgeon from the Sunshine Secunderabad Hospital. Today I am going to share my views on a very common topic which you all must have heard, seen or experienced, called as the head injury in the common words. Medically, the head injury is called as traumatic brain injury. Head injury is defined as a blow or jolt to the brain which results in either transient or permanent dysfunction of the brain. This can occur in commonly seen as a road traffic accident or a motor vehicle accident or fall from height or at home, and recently we have seen in the form of penetrating injuries occurring in missile or gunshot injuries, especially when in the terrorist incidents. So when an accident happens, there are 4 common things that indicate that the patient might have had a head injury. They are like if the patient has a loss of consciousness, he or she has a repeated vomitings, if there is an ear, nasal or a throat bleed, or if the patient has a seizure activity. So these are the 4 common things which, if happened, indicate that the patient might have had a head injury. There are other common symptoms like headache, giddiness, but these are the 4 most common things that can happen. So once you have got a head injury, then we see that the patient says he's got mild head injury, moderate head injury or a severe head injury. There is a scale called as Glasgow Coma scale, which is based upon the eye response. Motor response means the movement response, and the verbal response. So this scale has a grading which ranges from 3 to 15. So if the grade is 15, that means the patient is fully conscious, normal. If the GCS score is 3, that means the patient has got a severe head injury, it is in comatose condition. For the eye response, we have got 4 points. For the verbal response, we have got 5 points. And for the motor response, we have got 6 points. So if the score of all these 3 comes out to be 13 to 15, that means the patient has got mild head injury. And if it is between 9 to 13, he has got moderate head injury. And if the score is 3 to 8, it indicates that the patient has got a severe head injury. So now you got a head injury, you know how the scale. Then what is the investigation of choice? CT scan is the investigation of choice for a patient with trauma. People often mistake with MRI, but CT scan, I repeat, is the investigation of choice for patients with trauma because it is widely available. It picks up the clots and it is done very readily. Now comes what are the different types of head injury. So once you have an accident, suppose you are going in a bike, so your bike is going in a speed, the head also moves with it and head is lying floating in the skull, and when the accident happens, the brain gets hit into this bone, and this is where the trauma results. So the commonest type of head injury we see is called as a concussion type of head injury, meaning thereby when the accident happens, the brain shakes and hits the bone and the internal wiring of the brain is affected, and it manifests in the patient either in form of transient or some momentary loss of consciousness. The other type of head injury is called as focal type of head injury, which can either result in a fracture. There are different types of fracture, but the most important is the fracture if it happens and it goes inside the brain parenchyma, which is called as a depressed fracture, or there is a presence of clot, which we use in the normal words, also called as hematoma. Usually if this hematoma or contusions are big in size and they cause mass effect or pressure on the brain which results in deficits or the patient becomes drowsy or is unconscious, then surgery is indicated in which we take out the clot or hematoma. So this is the treatment of the hematoma. Thirdly, the patient may have a serious problem which is called as a diffuse axonal injury, meaning thereby the brain is badly shaken and there are small dot-like clots, bleeds in the brain, which results in a gross disruption in the functioning of the brain, and the patient presents in a comatose condition. So for these patients, we admit in the ICU, we give them or keep them on ventilator to provide better ventilation to the patients. And sometimes we put an ICP monitor called as intracranial pressure monitoring to see whether this problem is because of the raised pressure or it is because of the axonal injury itself. So this is how we treat the head injury patients. Now, the most important aspect of head injury is prevention. Prevention, as we say, is better than cure. The government is taking a lot of initiatives. There are a lot of social media sites. There are a lot of NGOs which are coming up, which say that helmet is one of the important things which we should always wear when we go out. Wearing seat belt is very important. So in short, at the Sunshine Hospital, we have got a dedicated neuro ICU where we take care of the patients who have this trauma. We have got the ICP monitoring equipment where if required we use it, and we have got a dedicated team of 24/7 available neurosurgeons and intensivists to take care of these head injury patients. Thank you.
Sunshine, it's our sunshine.